Welcome to our Caring for Patients and Families During End of Life. We've had a 3-part mini-series, and this is the 3rd of our 3 parts. So today we have Jean Whitlock, who is a licensed clinical social worker with a background in community and integrative health. She's been with the Resiliency Center for nearly 2 years. Her focus includes education and prevention and individual and group well-being and support after critical staff or patient events. We've got 2 support people involved. We've got Lorie Nielson, who is a board certified chaplain. Lorie has worked as one of the staff chaplains at the University of Utah and the palliative care team for the past 4 years. She's been working as a chaplain since 2004. And Lorie has worked in Berkeley and Manhattan prior to returning to her home state in Utah. Cassidy Doucette. Cassidy is a practitioner for the SOS, the Supportive Oncology and Survivorship team at the Huntsman Cancer Center. She's a certified in oncology nursing and is a past member of the Clinical Planning Committee and Patient Education Committee. Cassidy has taken an active role in advocating for patients and improving clinical care. I will turn it over to Jean.
Well, thanks for having me here today. Well, I'm going to just set up I'll just briefly tell you a little bit of our plan today. And then, so we will begin with a brief, what we call a check-in question. And that's what I was talking about with the breakout rooms, where I'll use that function of Zoom when that splits us up. Then I'll start my slides when we come back after we discuss a little bit and give some information just about a couple of things that we know about healthcare right now and how that affects wellness. And then we'll get into some tools and some strategies. And that's also where Lorie will come in and with some of the things that she has to offer as a chaplain.
Do you know if, as University of Utah and Huntsman affiliated center, if St. John's has any access to the resources that the Resiliency Center provides?
I was curious about the same thing, actually. My assumption is probably the direct services probably no. But if you wanted to reach out to me, that would be totally fine. The question I have for us to begin in our breakout room group is sort of twofold. So the question is, what is something you've done in the past in challenging times that has helped? And what is something you're doing now? So kind of that, what have I done in the past that was helpful? And what am I doing now that is helpful during challenging times? So I'll give you about 20 seconds to think about that. Go ahead and do the breakout rooms now and have you discuss this question.
Something that I've done in the past when I've been challenged or times have been really hard is trying to make sure that I dedicate time and space to physical activity and being outside. And sometimes that has come at the cost of other things, but in the end are kind of most valuable to me. And right now I'm trying to do that, but I am even more crunched on time than I've ever been in the past. So it's been challenging.
Is that fairly common among the folks you work with, the APRNs, the nursing staff, the social work staff? Is that a common outlet?
I think everyone has their own outlets. I think physical movement and being outside is definitely a common sort of helpful tool that lots of people do use, coworkers and patients alike. The form that takes, I think, is pretty unique to individuals.
Yeah, and I think that's pretty common. I mean, I've been to a lot of the hospitals in our region. People are out in this area because they enjoy the way of life. I find that those means of self-care, for me, the getting outside, but certainly just making sure there's time to get away from the clinic. Everybody has their own way, and whatever works for you. The important thing is simply that you take time to do it.
Yeah, and dedicating that time, I think, is the most challenging part.
Taking a few minutes to recap, maybe those of you who were able to be in a group, I'd be interested in hearing like themes that you've heard, themes that kind of came up between the multiple shares, or even sharing your own comment. It'd be nice to hear.
So our group had discussed about a couple of things. This is Brian. Some of the things that came up for us were having after work discussions amongst coworkers, exercising, and even having treats like cookie parties.
All sound like great ideas, right? Yeah, so noticing the theme of connection with other people being really important. How about others? Similar to that, to Brianne's comment?
I was just saying physical movement seems to be a common theme too.
And we talked about communicating with colleagues and staying connected with your colleagues who are sharing some of those stresses at work. Because sometimes when you go home, partners or family members or whoever you're connecting with at home may not have the same understanding of kind of the stressors that are going around on within the work environment.
Yeah, so there's no such thing as too much support is what I'm hearing. Having support both at work and at home.
We talked a lot about getting out in nature, and so exercising is part of that. And also community and gratitude practice, just that continual manifesting of gratitude in ourselves and then spreading that out.
And along with that was breathing. I think it was Mandy or Brianne brought up breathing, deep breathing, and just thinking about your breathing when you're starting to get that feeling of being overwhelmed.
Thank you. So I think these are all great responses. I want to ask what you'd hope to walk away with today after the end of this time together. So I'm going to go ahead and move to my slides. We know that this year's been a lot with the pandemic of corona, the pandemic of racism, and the natural disasters that continue to occur. And I just wanted to show this slide. This is a slide from a mental health resource called SAMHSA. And this is going over crisis response and what we can expect. So if you could see here, it's emotional highs and emotional lows. And as you go along, there's these different ups and downs with the emotional highs. The phase that we're most likely in is this disillusionment phase, which is kind of a depressing word just to hear that that's where we're at. And as you can see on here, there's like ups and downs with that. And this can last up to 1 year. So why am I showing you this? Because I want it to be clear that no matter how good you are at getting through a tough day, taking care of yourself is going to be necessary to get through a whole year. This is showing Stanford's model of professional well-being and fulfillment, and it kind of breaks down like factors of what prevents burnout and what can also contribute to burnout. And so there's these different ways of looking at it. There's the personal resilience, which is often what I talk about as a social worker. So this is kind of getting to those practices that you just described. Getting outside, taking care of myself, gaining knowledge, education, and training, and all those kinds of things. And the way I take care of myself can lead to this idea of the culture of wellness, which is what's the norm? We hear a lot about a mental health stigma. So culture of wellness is the thing that contributes to that or that can curb that. So if we have a culture of wellness, there usually is less of a stigma. It means that we're all willing to get help when we need to. It means that it's not shameful to ask for help. So these different factors affect our well-being. The other one is efficiency of practice, which we can maybe call the system. So some of those things that break down that cause burnout, where it's like there's like bottlenecking in the process of our work or whatever it is. There's lots that goes to the efficiency of practice. This is just a way to think about when things are overwhelming, it's helpful to break it down. And that's the work that I do, is breaking stuff down, even down to like what thought is coming up, what feeling. And so this is just a place to start. So if we think about what we're doing today, we're talking about some personal resilience strategies, and that's really going to affect the culture of wellness for this group. So I'll try not to spend too much time here. Just want to get into why what you mentioned is so important, those little coping strategies. So this is, if we think about these zones, these are zones to think about for the regulation of our bodies. So this green zone is, we could think of it like homeostasis. And in this zone, you can experience all kinds of feelings. You can experience all kinds of experiences. So you can be curious, you could be adventurous, you're going to grow in this zone. And when the stress of life kind of gets too high and we start getting up to the top of this homeostasis window and we exit that window, we kind of get into this state of hyperarousal. That's what we would call fight or flight. And when that gets exhausted in the body, either it will return to homeostasis, or if it's up here hanging out too long, it's going to go to this freeze state, this hyperarousal. So I just want to bring this up because everyone is going to have to learn their own version of this. Everyone's going to learn, when am I in fight or flight? When am I numbing out or shutting down? And you don't even have to be extremely like sophisticated to know this. We all kind of have those feelings of like, I just had to shut down. I can't take this thing on. You know, we maybe don't call it these things, but we might know we're there. And if we think about a year-long stressor, like coming out of this pandemic, we're going to need to get into homeostasis as much as we can, right? And these extreme states are what wear out the body. So those are just a few notes there. And I wanted to mention, again, sort of the risks that are for healthcare professionals. So this idea of secondary trauma, which I call primary trauma, because if it's happening to you, even if it's something you're witnessing, it's happening to you. And so that's not secondary. You're witnessing something, but the pain that comes with that is yours to deal with. And that's this idea of like the natural consequence of and behaviors that come from being exposed to stuff often. And so what we know about healthcare professionals is that if we don't respond to that, there's a lot of consequences that come out both for the individual and for the system itself. So medical errors, patient satisfaction might decline, more disruptions in the teams at work, and then also those individual family and personal disruptions. So this is what I would hope you can hear as well, is that secondary trauma doesn't have to be one big event. It can be many different small events. And some things for you to look out for are on this slide. So if you noticed a change in your sleep that doesn't go away, that maybe feels like anxiety, or intrusive thoughts. Intrusive means that you might be doing something else and suddenly an image or a thought is coming into your mind and you don't want it there. That's intrusive. If you feel guilt and shame coming up more than usual, those are all signs that, like, in my opinion, as a mental health professional, like, I'd want you to see me. I'd want you to see somebody. And talking back to that culture of wellness, can we make that possible for people? Can we say to each other, you know, I've noticed that you've been off a little bit. Have you thought about talking to someone? Can we say that to ourselves? So just that validation that these feelings are maybe typical and that they're more normal than not, and that you don't have to continue to suffer with them and wait for them to get better. Like, you can reach out and get some help. So before we move on, any questions or comments with what I just went over?
Generally speaking, would you say that contacting a social worker even within your facility, home facility, if they don't have a resiliency center, or where are some other places that they can go in case they don't have something within their own facility? Or who could they go to ask what's available?
So most social workers in a hospital setting would probably be a really great resource for resources in the community. And so I think that's a great idea, even if that's just, hey, I'm thinking of talking to somebody. And talking to somebody doesn't have to be a professional, but again, those symptoms might be good reason to bring that up. But I would say talk about it anyway, even if you can't get to a professional immediately. Yeah, I think talking to a social worker is a great idea. There's a website called Psychology Today, And that usually you can filter things by your zip code. So that's another option as well for getting some names. And I can send that along in a follow-up email as well. Any other questions?
This isn't a question, but more just, I am aware that they at St. John's, they do have a social worker that comes on and does a little 15-minute session. And I imagine that the social workers that do that would be a great resource for them to touch base with. And it's also like they're doing them on communication, they're doing them on just dealing with emotions. So using the resources and the people that are right there in front of you too.
So maybe that would be a good thing to preemptively ask one of those social workers, is maybe getting just a list of local resources out there. That might be a good idea. Any other questions or thoughts?
I think it's helpful just to normalize it, because especially when it comes to end-of-life care, which we'll talk more about later, but even as nurses, the amount of emotional weight and stress along with kind of a strained mental capacity and even physical at sometimes, nursing is really hard, especially taking care of patients in the midst of a pandemic and with cancer to boot. I mean, it's amazing, and I'm glad it was already brought up about the peer support, because, you know, like Megan mentioned, talking with someone can be in more of sort of a counseling or talk therapy or professional environment, but as someone mentioned, it can also be really helpful just to feel like you have a safe enough culture within your team and with your coworkers to kind of debrief and talk with each other and be okay about being honest when you are feeling a little burnt out or kind of at capacity or struggling.
Yeah, when that gets brought up, I like to ask, and this is where we get to that discussion portion. I like to ask, what makes it hard to talk to each other sometimes about feelings that aren't necessarily our favorite feelings, or some of the challenges we come up to? What makes it hard to do that?
I have my own perspective on that. What makes it hard is people don't really know me. What would help me being able to really say how I feel frequently comes across as really, really harsh. And because I don't know many people, I moved up here to take this job 3 years ago. I really don't know many people, so I just don't.
Yeah.
So what I hear in that is a few things, right? One is that interpersonal familiarity and feeling loneliness in that when we don't have that. And I'm also hearing, in terms of like what stops me, is that fear of being misunderstood. You said I come across a certain way, or I get, go ahead.
And not just misunderstood, but sometimes judged. People will ask me, aren't you a nurse? How can you say things like that? Well, because I'm a human. So I just shut up most of the time. That's my one comment for the entire series.
Thank you, Diane.
I will comment on that, in that I think that we all come as, like you said, Diane, we come as our own individual human beings that, you know, like you said, people don't know, and you may have, people have a lot of things going on behind the scenes, and the stress and the overwhelmingness that comes on with nursing we always have to remember that everybody has a day ahead of them or behind them, and it may involve many, many things that aren't related to work that can be really difficult and challenging, come with our own experiences and backgrounds. That not knowing each other on the workplace and maybe not even connecting can definitely add to that. There's also a comment, with all the crazy times our world seems to be more in a hyper state. St. John's does have lots of good resources for staff. I feel bad for the patients who don't have family members at their bedside because of the COVID restrictions. Yeah, and I think that probably adds quite a bit.
And the additional weight that our role that puts on staff that is bedside, that is in person, because there's both that navigating between the families and also being the eyes often on the patient that family normally is able to provide. And even back to Diane, to your comment about, connecting, is that not knowing that we're in this stage of, there's so much we don't know right now. And just because we're in the middle of it in the hospital doesn't mean we know. And so that perception that others would have about you as a nurse, or someone as a nurse or a care provider, knowing, it's like, well, no, don't know, because we're in this state of not knowing. And also just the emotions that are strong, because we are human and we bring our humanness to our work.
Diane, I really appreciate you being willing to comment, even if it's one or more other comments out there around this idea of like either what stops us from connecting or what's been helpful to help you connect.
I think as clinicians, I think it's important to stop and think about that. Am I even trying to get to know somebody that I work with? Maybe pausing a second, and we get so busy in our work that are we actually asking those questions of, hey, how are you today? Or, maybe you have somebody new that you've worked with that, again, either just moved there or just started on that floor. Are we taking the time as individuals to kind of stop a second and get outside of the work environment in order to create that support system at work?
Yeah, and I really liked Adria's comment, because if we're in a hyper state more often, if you remember, like that homeostasis is where we try new things and where we grow. And so if we're in a hyper state, we don't have energy for that, right? Like we're in a survival state. So we don't necessarily have that energy to branch out and maybe form a new friendship. And that this is where it's like, we're not stuck up there all the time. We could do even taking that breath is one of those ways to get in homeostasis. So it's not so much like I have to do big things, but how do I do a little connection, right? If making a new friend is like, that's so overwhelming, what's the smallest version of that? And that can actually drop us down into homeostasis, even if it's for a moment.
I think especially right now, the whole world is in that hyper mode. People are just trying to figure out how to make it from one day to the next. Yeah, I just had this hilarious image in my head when you said, what's the smallest version of reaching out to make a friend? Hope they hold on tight when I get on my motorcycle.
Well, that's a perfect comment for my next slide. It's always really great when someone from the crowd is my transition, because sometimes that smallest version is just inside of us. Sometimes it's connecting with ourselves. One thing that I believe about compassion fatigue, and this is connected to what we know about emotions, is I don't believe that people get tired of being compassionate. I think that they still feel compassion even when they're in that state, or have that belief about compassion, but they're tired of exercising on it. They're tired of acting on it, and the muscle that they use to act on it is grown tired. And usually that's a sign to go towards that self-compassion. Usually that's a sign when we're feeling like I cannot act on this one more time. It's a sign that I need to do it for myself. And that's one of those little versions that I was talking about of how do we do even just this little thing and get into that homeostasis, even if it's for a moment, because if I get good at doing that, those moments add up, just like they add up if I'm in the hyper state a lot or hypo. So I'll go ahead and share my screen again. Feel free to ask questions along the way. And I wanted to offer this tool. So when it comes to end of life care, which is this next slide, it's talking about the same thing. So I just have this quote, and it's bringing up grief, but I think most of the work I do as a therapist is about grief, because most of it is about things outside of my control that change and things inside me that change, that I am mourning. So this quote just says, every great loss demands that we choose life again. We need to grieve in order to do this. The pain we have not grieved over will always stand between us and life. When we don't grieve, a part of us becomes caught in the past. So just wanted to mention a few things about that and then apply it to the self-compassion tool that I was bringing up. So just a couple of things. I'm using the word grief. We could go into that very thoroughly because it's a very interesting topic, but just the way that I'm bringing it up is not to say that it's about death, because there's a thing called intangible loss and intangible grieving. And so that's like this myth number 2 says grief is only felt when a loved one dies. And grief, when it comes to the pandemic, when it comes to patient care, might be different than it is like when we're losing a loved one in our own life. But we still, as that quote mentioned, like we'll still have some sort of part in the process, usually when there's a loss of any kind in our life. So just wanted to bring up some of those things. And one thing that Lorie and I hear a lot is this idea of like, if I stop to feel what I'm feeling, it's all going to come out. So if I, as a healthcare person, am busy with my day and there's something that happens that I feel something about, if I stop to feel that, it's all going to come out. And I think that that's fair in a lot of ways, but the thing that usually doesn't, that gets pretty internalized in nurses. They're really good at doing that. They're really good at saying, okay, I'll just compartmentalize this and move on. What I think that the culture has left out is that ability to feel the feelings later, because that does need to happen at some point. So it doesn't necessarily have to happen at work, but part of the get back into that homeostasis is these little ways we acknowledge what's going on for us. So we have a couple of tools for you to do that. So this first one is the idea of steps for self-compassion. And we're going to give it just a few minutes. We're going to try it in just a minute here as well. So the steps of self-compassion, as is researched by Dr. Kristen Neff, the first step is to acknowledge the suffering. So I like to give a couple of examples of this. Suffering can be in the body. So maybe that's my stomach has been nauseous all day. Let's acknowledge that. Maybe that's my tension in my shoulders has been there all day. What if we just acknowledge that? And we say, I see you, tension in the body. Suffering can be in the emotions. So maybe I'm caught up in shame and guilt. And if we think about how heavy that is, that's acknowledging the suffering. So maybe it's, boy, I've been thinking about this problem for 20 minutes and I can't feel any better about myself by continuing to think about that problem. Let's just acknowledge how painful that was to go through. And that's acknowledging the suffering. It could be cognitive. We talk to ourselves pretty critically often. So maybe something like, you're a failure, that might come up, and we can acknowledge like, that's not an easy thought to have. So those are examples of acknowledging the suffering. Recognize the human experience as a second step. So usually that just looks like maybe a phrase like, everyone feels this way sometimes. I'm human, and this is what it is to be human. Humans feel shame sometimes. Humans feel guilt. Humans are not nice to themselves. So that idea that what I'm experiencing is a human experience. And then the third is to actively comfort. And again, this can look like anything. This can be as simple as, I'm just going to be aware that I said something unkind. And that's an act of comfort, to just say, wow, that was not very nice. It could be taking time. So it can be in the moment, it could be small. So kind of again, like I like to use that analogy of, if my shoulders are hurting and I'm acknowledging that suffering, a pretty logical act of comfort is to stretch. And that's an act of compassion. So those are the steps to compassion. So I just want to give you 1 minute to do a little body scan yourself and notice any tension in the body and follow these steps. So first you're going to notice where it is and acknowledge it. And this could also be emotional or mental. Then you're going to notice like, this is part of being human. And then I want you to do something. So even in this moment, I'm going to give you a chance to stand up and stretch, or get a glass of water, or take a deep breath. So we're going to give you a moment to do that.
We'll do it.
So I'm going to continue because of time, but hopefully with that, I just want you to notice what it was like to just take care of that in a moment and how rarely we do that. And I want you to think about, could I do that more? So some basic ideas about self-care checklist. Just even, am I meeting my basic needs? Am I taking breaks? Am I recognizing what is going well in my life? Am I staying connected? Can I ask for help? Those are some of the basics that I can also send. So I wanted to give Lorie a chance to share a couple of things. So that's something we could do as an individual, and Lorie has a few things that we could do as a team, and also she can add individuals. So oh boy, we are short on time. So I'm going to turn it over to Lorie, and then we'll just give another minute for questions at the end, and then we'll end with that.
And I will, right about 3 minutes until 4 o'clock, I will post the poll for the end for the nurse contact hours. So, but just fill it out and then you can make it small and put it aside.
So I like to, on the palliative care team, we have a practice. So with death and dying, we're in the presence, and if your position has not actually dealt with a lot of death in the past, and now maybe you're seeing more of it, it's just kind of like you needing to find those other processes that meet the new need. And with our deaths, we have a ritual that we do every week where we name all the names. So we say each of the names of the person that has died, the people that have died, and we give space after each name is spoken to be able to, if someone has something to say, or even just honoring that even if no one in the room actually touched that patient, but it was touched by someone in our team. And so it's also holding space for that whole team. And we say the name, and then at the end of it, I ring a bell. And it's the sound of the bell is that impermanence, allowing ourselves to be touched and then allowing it to dissipate. And I like to think of it a little bit like Velcro. As we need, like there are some things that, they kind of just move right through us, like Teflon. And then there are some things that kind of stick to us like Velcro. And if we've got too many Velcro things, we get kind of weighed down. And so having practices that work for us as individuals and normalizing it as a community to allow some of those Velcro things to be released. And so for me, when I sanitize my hand, because we all get to sanitize our hands all the time, when I'm putting my hands together, I feel my hands. And so I'm touching into my breath. And then the stethoscope, when you were showing the stethoscope earlier, I was thinking so every time you're gonna go check someone else's heartbeat, so right before you go take it off of your neck, you pause for a second and you just check in on your own, because you're titrating that own physical experience and that own honoring of you are also in that room. And these rituals can kind of do that too. So what I'd offer is maybe find one of the little Velcros that you have. And it could be maybe a death that's occurred, or maybe it's a thought pattern that you're aware of that's no longer serving. Just something that you want to honor and invite to go. I'll give you a very brief moment to just hold that in your awareness. And then I'm going to mute myself in a second. And then we have it written down. And the more of our senses we engage in something, the more it can actually move through. And the more it can also be part of our being. So saying what that is, verbalizing it. And then I will ring the bell as a way of letting it go. And the 3 rings are go in peace.
think sometimes too, if the bell didn't come across very well, a helpful tool that I use and I've shared with lots of patients is envisioning those emotions or whatever you're holding on to like a wave. And many of us have probably experienced waves in the ocean where if you fight against that wave, it gets disorienting, it gets overwhelming, you feel like it pushes you down further. If you can touch base with yourself and take a deep breath and witness and sort of see that emotion or that feeling wash over you like that wave and keep going, then you might find yourself in sort of calm waters on the other side. And so that physical visualization for me of like washing that away, and a powerful tool that we use in Qigong and so many other things, yoga, is that breath can be that wave sometimes too. And nurses that have seen me in the hallways of our hospital sometimes giggle because I will physically like step out of a room and I'll go, whew, and like throw my arms down and literally shake it off. And it's a very real reaction that happens in our body when we get that kind of good flood of oxygen and just release of energy. And it, once you get over the awkwardness of looking a little silly, maybe you need to do it in the bathroom on your own, but it's a really helpful tool.
Way to stand for some culture there, Cass, of I can be myself in this environment and I can take care of myself. And that's kind of the end of where we're at. So I definitely have some things I want to follow up on that I can send. Lorie, I think, can probably send the steps to what she just did. And again, I love how she does. She told me once like that, how she said the bell represents that impermanence. And she says, listening to the sound of the bell changes over time. And that's just that signal, that's enough of a signal to the brain that it doesn't need to flight or flee or fight. It's enough of a signal to say, I can just be for a second. And that same with what Cass is describing is that little transition, those little hand sanitizer moments. Those are all ways that the brain can say, I'm safe to breathe. And it won't do that if it thinks it should run away. So any questions for me before we sign off?
No, Jean, I'd really like to thank you and Lorie and Cassidy and your whole team for presenting the information today. I thought it was very helpful. Definitely, we're all dealing with a lot of stress right now. So I very much appreciate you all taking your time and sharing with all of us. And thank you very much for joining, everyone. And thank you for participating in the last 3 sessions.